Hello, fellow classmates, and thank you for tuning into my video presentation. My name is Graham Fletcher, and my presentation and paper are about the plant-based diet and weight loss for the treatment of obesity. My research question is, does a plant-based diet increase weight loss and aid in the treatment of obesity in adults? Now, I chose to research the plant-based diet because it is what I am currently consuming, and I wanted to learn more about it and also see what has been found through these randomized clinical trials, um, and kind of just see the significant statistics and all the findings that have been done on this. So that's why I chose this. My thesis statement is the consumption of a plant-based diet over 4 to 6 months leads to an increase in weight loss in overweight and obese adults aged 18 through 65. And I did 18 through 65 because that's what all the studies uh, tested on, and same with the time frame there, 4 to 6 months. Like most all the studies end up being like 16 weeks or 6 months. Research findings. So in all the articles I found, the plant-based diet showed an increase in weight loss for all the participants who were randomized to the vegan or plant-based diet. And they measured, I guess, the body composition through body mass index measurement and fat mass. It was also made clear through one of the studies that I found that plant protein is more satiating than animal protein, where they did a side-by-side comparison of like a tofu burger versus a cheeseburger. Now, this diet does not require carbohydrate restriction, which was tried in one of the clinical trials that I found, but it is best to restrict extra fats like oils. If a vegan diet is unattainable, then it was shown that a vegetarian diet is a pretty close second for that increase of weight loss, followed by a pesco-vegetarian diet. Vegan diets are a good treatment for obesity and a good way to increase weight loss in general. Further research should definitely include longer studies with closer monitoring of the participants. A lot of the articles that I found relied on self-reporting and only had like maybe a couple interventions like by professionals where they would actually find out what they'd been eating for like the past 24 hours. So I think there need to be more studies conducted with closer monitoring. But the short-term studies that they have done so far have shown great results, but of course they are relying on that self-reporting. And in addition to the long-term studies that they need to do, they should also do studies that focus on the relationship between plant-based diets and their effect on type 2 diabetes and cardiovascular problems, because some of the studies that I found kind of went into measuring insulin resistance and whatnot, and macronutrient intake. So I think they can dive further into those things and can also show other benefits of the plant-based diet. So thank you for listening.